So you guys, now we need to talk about the innervation of the anterolateral abdominal wall. So think about it. I need to have innervation for my anterolateral abdominal wall. Okay, great. What are the nerves that I already by now know all of them that would give me innervation to the abdominal wall? It's gonna be, guys, the nerves coming from intercostal nerves. Okay, you guys know that you have intercostal nerves. And these intercostal nerves, the lower ones, starting from T7, so usually they say the lower 5 intercostal. Lower 5 means that T7, T8, T9, T11, T12, but T7 to T12, we call them intercostal. To T11. T12, we don't call it intercostal, guys, because this is below the 12 rib. And here I don't have rib, so it is subcostal. All right, guys, so I call it subcostal nerve. So I have the thoraco-abdominal nerves. We call it thoraco because it comes out of the thorax. It comes out of the thoracic nerves, which are the intercostal nerves. Abdominal because it supplies the abdomen. It gives innervation, and it gives innervation to the muscles, and it also gives cutaneous innervation. Okay, correct. So it takes innervation from the lower 5 intercostal because we start from T7. And then all the way, once you have the subcostal nerve is the last one. Now, what else do I have? Remember, guys, the lumbar plexus, we talked about it in the renal module. Go ahead and watch it, guys, because the idea is just there summarized nicely. So you have the lumbar plexus, and those nerves explained in the renal videos. Two important nerves you guys need to understand are contributing here to the innervation of the skin and muscles. Okay, what are these nerves? If this is the lower 5 intercostal and I have this subcostal, remember that next one was the subcostal, which is T12, and then I have the ilioinguinal, and iliohypogastric comes first. So this is iliohypogastric. It goes to the hypogastric region, goes all the way to the hypogastric region. So this is ilio H, hypogastric, and the one that goes in the canal to go and supply structure here, I call it ilio inguinal. All right, so the innervation is just simply these 4 types of nerves: intercostal, subcostal, iliohypogastric, ilioinguinal, and this is the distribution in order. Okay, now let's talk about the wall, the superficial arterial supply. Now, in general, guys, because this is a huge topic, let's just remember that we have the heart, and we have the arch of aorta, we have the brachiocephalic, you have the common carotid subclavian. You guys understand that the subclavian gives you the internal thoracic. Remember, that was your thoracic cage. All right, you had the internal thoracic. The internal thoracic is explained in the respiratory module. The internal thoracic, guys, at the rib number 6, it will terminate, and it will end there because it's no more internal thoracic, no more rib cage. It's gonna end up as musculophrenic because it supplies the muscular part of the diaphragm, and superior epigastric because it will go to the rectus sheath at that point. So this is superior epigastric, guys. Okay, a superior epigastric branch of internal thoracic. Now, this is above. What happens below is that you know that the abdominal aorta finishes as at the lower of L4, at the level of L4, as 2 common iliacs. The common iliac will give you internal, which is not my concern. It's a pelvic artery, and external iliac, which is my concern. The external iliac will then, after the inguinal ligament, it becomes femoral. What's gonna happen here is the external iliac, guys, will give you 2 important arteries. One medially to go to the rectus sheath, which is the inferior epigastric, we talked about it, and one it will go to reflect back, which is basically here. This is the external iliac. It gives you inferior epigastric and deep circumflex iliac. Deep because it's a deep artery, circumflex because it winds there, and iliac because it goes to the iliac region. All right, so if you guys look at this very, very nice diagram, it shows you that the supply at this rib 6, you will have the musculophrenic, and then you will have the superior epigastric. It gives you arterial supply up there, and then the inferior epigastric, we talked about it, comes out at the level of the arcuate line to give you deep arteries, and it also give you superficial arteries. Okay, now the deep circumflex iliac will give you a deep arterial supply lateral there. So you have superior epigastric, inferior epigastric, all right, and also remember, our friends from the thoracic cage are not gonna leave us away. Remember, they will also helping us in innervation. They will help us also in the arterial supply. So we will have a blood supply from the 10th, 11th posterior intercostal arteries and subcostal artery. Now, we are here superficially, and I just want to tell you a small story about the femoral artery. The femoral artery, guys, can you see? I'm very sorry, guys, in this this one as a branch. This is once we are down to the femoral, so once we're down to the inguinal ligament, this is femoral artery. So what I pointed here, this is the superficial circumflex iliac. The deep one here is the external iliac. External iliac will give you inferior epigastric and deep circumflex iliac. So this is deep circumflex iliac and this is inferior epigastric. Okay, it's in the same place, but just because I have a landmark here, the inguinal ligament, so I need to be specific, and because I want to talk about the femoral artery now. What's gonna happen is, guys, the femoral artery, once we proceed and we come and exceed the inguinal ligament, we are femoral. The femoral, guys, is gonna be very jealous of the external iliac. It's gonna say, okay, so now you have inferior epigastric and you have deep circumflex iliac. I will make superficial epigastric and I will make superficial circumflex iliac. Okay, guys? So when you want to study the arterial supply deep, just remember the superior epigastric, inferior epigastric, and the intercostals. If you want to study the superficial, remember the jealous guy here who is just copying the external iliac, who made the same thing, but he made himself superficial. So superficial epigastric will come here and the superficial circumflex iliac will come here. Okay, and also superficial external pudendal is a branch of femoral artery. So this is branch of femoral artery, and this from the internal thoracic, and this is from external iliac. Okay. Okay, deep supply. In the deep supply, remember that we said that we have the deep circumflex iliac and the musculophrenic branch, terminal branches of the internal thoracic. Okay, remember we had the internal thoracic here, the superior epigastric, and then the musculophrenic is gonna be here. So those are the guys of the internal thoracic, and from external iliac we have the guys who are the inferior epigastric and the deep circumflex iliac, plus our generous guys who are the intercostal related stuff. Okay, so now it's becoming very simple. So we talked about the arterial supply, and now I want to talk about the veins. Now, the veins are just similar to the arteries, okay, except for one idea. Now, you have the superficial epigastric, you have the the superior epigastric, and you know that it's coming from the internal thoracic, so it's gonna go ahead to internal thoracic vein, fine. Inferior epigastric vein, okay, it was coming from external iliac, so it will go to external iliac vein, fine. Just one thing I want you to know, that we have a vein here called lateral thoracic vein, and the lateral thoracic vein, it also drains from the lateral abdominal wall, and the lateral thoracic vein is actually connected. It's actually connected with the superficial epigastric by something called thoracoepigastric vein. Why it's important? Because this is one of the channel that is gonna open if there is if there is a blockage or a portal hypertension. I'm gonna talk about the idea now. Okay, so just remember that we have an extra lateral thoracic vein, and it is connected with the superficial veins by thoracoepigastric vein. Okay, everything else, guys, we already talked about them. The veins, just like the arteries, except for the ideas that if we are above, we are draining into it depends. If we are internal thoracic, we are draining into the systemic circulation, superior vena cava, fine. But if we are below, we are going to drain. If we are intercostals, we are draining into the esophagus system. Okay. And the esophagus system is already explained in the thoracic module, okay? And if we are down, Okay, great. We are draining into the external iliac, and that is going to go all the way to the common iliac and then inferior vena cava. Fine. Now, the important idea here, which is already explained in the liver video, is that you guys, we have you guys know that in the okay, you don't know because it's in the coming videos. In the GIT tract, you guys, you have all stuff coming and the food coming. Everything you guys need to go to the liver to get processed, because before it goes to the systemic circulation. Okay, so that goes by the portal vein, because we need to take the nutrition, do to detoxification, breaking down drugs. So the blood comes out of the GIT from the foregut, from the midgut, from the hindgut, okay, needs to go through the portal vein into the liver. And that is what we call the portal circulation. But regularly, the organs with other organs is going to drain into the systemic circulation, which is the superior vena cava, inferior vena cava to the heart. In some areas, guys, there is a communication between the people draining into the portal vein and people draining into the caval system. One of these regions, guys, is the umbilical region. In the para-umbilical veins, guys, some of them are going to go to drain by veins around the ligamentum teres here, and they will drain into the liver, and some of them are going to drain superficially into the superficial circulation. If there is a liver disease, if there is a blockage to the blood from draining, like liver cirrhosis, there will be portal hypertension. This idea is explained extensively in the coming videos. What is going to happen is the blood is not going to find a way out, so it will come back. And remember, at one region, I had people draining into portal circulation, I had people draining into systemic circulation, and I had closed the channels between them. If those guys don't know how to drain into portal circulation, they will go back, and then they will open the channels, and then they will try to drain through the systemic circulation. Opening the channels is going to make you those problems, which is, it depends on where you are. In the abdominal wall, they will call you this clinical feature, which is the caput medusa. Okay, so this is because of this, you can find it in patients with liver diseases, and that will open up all the channels and causes dilatation of the superficial veins because they are trying to drain and they're finding their way closed. All right. Okay, guys, so this is just a nice summary about the idea of the intercostals draining into the esophagus system. Okay, all right, so we're done. Thank you guys for watching, and I hope you grasped the concept very well, and see you in the next videos.